The Oral Health Office of Alabama's Department of Public Health has 3 team members. Last month, I spoke with Jennifer Morris about their community dental care program. Joining me in studio today are Dr. Tommy Johnson, the office's director, and Mallory Rigsby, the coordinator of community water fluoridation. Thank you all so much for joining us here today, and a big welcome. Your first time here in the studio. We're very excited about it.
Thank you.
Well, first, before we get into the nuts and bolts of our conversation, let's start with you, Mallory. Tell us a little bit about your background and what led you to where you are today.
Okay, I started my career with the Department of Public Health in 2010. My degree is in Health Services Administration. I spent 8 years with tobacco prevention and control, and I spent a couple years with Alabama Childhood Lead Poisoning Prevention. And now I have been with the Oral Health Office as the fluoridation coordinator for almost a year.
Well, thank you. And Dr. Johnson, how about you?
I'm actually a Georgia transplant. I grew up there, and I went to LaGrange College, decided on a dental career. I graduated from University of Alabama School of Dentistry, and for 28 and a half years I was in private practice, mainly in Mobile. And there were some changes that took place at the office, and we made the decision that one of us would stay. It was a partnership, and the other would go, and I volunteered to be the one to leave. I thought there were some other things out there that I'd like to try. So in October of 2017, I started as the dental director for the Department of Public Health. It gives me a little bit different perspective because of the fact that I did come from a private sector into public health, and I see the disconnect between the two of them, and that's one of my goals, is to be able to take it and correct that, bridge that gap, and let the people that are in private practice actually know that there are resources that are available to them that they don't know about.
Well, I hope what we do here today helps bridge that gap, bring all of us a little bit closer in this dental care work. I know when you and I were talking in preparation for this interview, you said something that really stuck with me. And my takeaway from that statement was you want the mouth to no longer be considered an afterthought. What did you say?
It's my opinion that somewhere along the line the mouth got removed from the body. When you look at it from the standpoint of even an insurance company or something like that, the way that they deal with things, we are completely a different entity. Everything else is a specialty of medicine, and dentistry is not. And that, to me, that makes no sense, because the connection between oral health and overall health is undeniable. And so that's one of our goals, is to let people know that that this is the gateway to the body, and so we're doing our best.
We're going to talk in a little bit more detail about that connection between the mouth and the rest of the body, because it's quite fascinating and incredibly important when you talk about overall good health. But I want to start with a big piece of this puzzle in bridging the gaps and making dental care more of a priority. You have in front of you the copy of our state's dental plan. Talk a little bit about that document and how what I think that's the starting ground for what you're trying to do.
Right. When I first came to public health, there were two things that were priorities for me, that were told by our deputy director that this is what you need to concentrate on first. The first one was Children's Dental Health Month, something really big for it. And as you came and we appreciate it so much that you came and interviewed our winners last.
My pleasure.
Was it last week? I lose track of time at this point.
Yes.
But I would be remiss if I didn't, mention that, since it is Children's Dental Health Month. And so we have Kaylin Patterson and Braylon Coven are our winners. So that was one of the things that I designed, was a statewide smile contest to bring attention to Children's Dental Health Month. The second thing that I had to do was to create a state oral health plan. Alabama at that time was one of 14 states that did not have one, and so that was where my priority was focused. And so what we did was our Oral Health Coalition of Alabama, which is just a ton of different organizations, groups, offices that get together, we came up with this state oral health plan. And so I'm very proud of the fact that I had the opportunity to author it, and it being the very first one that Alabama has had. But just as we talked about, as far as designing the book itself, my what I wanted it to convey from the first time that you saw it was the connection of the mouth and the body, and that's the reason that the cover looks the way it does.
And since you say that, I have a copy of the cover here, so I will hold this up as you continue to talk about that so people can truly see what you're talking about. And these documents are available on your website. We'll mention that a little bit later, but this is exactly what you're talking about. What,
Yes.
a 100-page document that kind of sets some goals and priorities for what you want to do regarding our state's dental health care.
Right. A state oral health plan is sort of a roadmap to direct us as a state to specific concerns. There are 5 of them that we have listed in our oral health plan, and the first one is increase access to health care. The second is professional education and integration. The third is health literacy. The fourth is data and surveillance, and the fifth is prevention. And so that is what this document focuses on.
In a category of health literacy, that circles us back to what we were discussing a little bit earlier about that mouth and body connection. I want to highlight a couple of health issues that we know are very important when we talk about dental care. Let's start with dental care and certain types of cancer. How are those two issues connected?
Very tightly. There are several different types of cancer in the mouth. Several different areas where you can have it, but one of the ones that is a focus of ours is HPV-related oral pharyngeal cancers. And the oral pharynx is the back of the mouth. So if you have an HPV-related cancer, it's typically confined to that area back there. There are 2 strains which are primarily responsible for our oral pharyngeal cancers. And you can have oral pharyngeal cancers that are not HPV-related, but that is our focus. And so what's really important for us is to promote the HPV vaccine. And when you look at it from an interprofessional collaboration type of a situation, it could not be more of a perfect example because of the fact that this one vaccine takes care of 6 different types of cancer.
Wow.
It protects. It doesn't necessarily, we don't use the word prevent, but it protects against them. And the earlier you take the vaccine, the better. But as a dentist, if I, and here in Alabama, we are not, at this point in time, as a dentist, we cannot actually administer the vaccine. We refer to a physician to get the vaccine. And there's some thoughts along those lines as far as other states have actually begun allowing dentists to give the vaccine. But when you look at it from a standpoint of, as a dentist, I can recommend a vaccine for oral pharyngeal cancer, but at the same time it protects against the other 5 too. And cervical cancer is one of the other the really big ones. And as a matter of fact, several years ago, the incidence of oral pharyngeal cancer in men surpassed the number of cervical cancers in women. And that's not what people hear when when you're talking about HPV. They typically don't associate it with the type of a cancer in the mouth by men that's that prevalent.
Exactly, you're right. And I know it also has a connection to cardiovascular disease, and we don't really have time to get into all of that. But I know another issue that's very important to public health is dental care and the Count the Kicks initiative. Briefly share that connection between those two.
One of the things that is of utmost importance in dentistry is the need for expectant mothers to actually have good oral health. The same bacteria, some of the same bacteria that are present in gingivitis, periodontitis, periodontal disease, those bacteria can cause low birth weight preterm babies. And both of those are actually, they're connected to infant mortality. Well, Iowa, the state of Iowa, sometime back, they decided that they would come up with an initiative, a way of being able to monitor a fetus's movements. So they began in the 3rd trimester to monitor the amount of movement that the child had, and if there's a reduction in the amount of movement, then that is a sign that there could be potentially something wrong with the baby. And so they came up with this idea, and it's called Count the Kicks, and it's an evidence-based campaign, whereas that's what you do. You monitor the movements of the child. And so in a period of 10 years, they had a 32% reduction in stillbirths as a result of the Count the Kicks initiative, just nothing more than just knowing the movements of the child. And so very recently, Iowa decided that a really good place to actually promote this would also be a dental office, because of the fact that most people see their dentist more than they see their physician. And your hygienist, especially, if you develop a rapport with them. I don't know about you, but I can tell you that when a dental chair leans back, you find out things about patients that you never even wanted to.
Okay, as a patient, I will confess I have shared.
So, what better opportunity can you possibly have as a hygienist to in the third trimester? Because at that point in time, in an ideal situation, you have been made aware of the fact that the mom is expecting anyway, and to have this conversation, and even though it's an app that is that's available on your phone, especially here in places like Alabama, we have areas that don't have really good Wi-Fi, and so they developed a way to actually help with that too. It's a wristband that has a slide on it to help you keep up with those movements. But one of the things that we were able to do is once we decided, Iowa is who developed the Count the Kicks initiative to begin with. They are also the first state to promote it in a dental environment, and Alabama is the second. So that makes me extremely happy. And so we actually had a proclamation signed for this past December being declared Count the Kicks Month in Alabama, and the people at Count the Kicks, the parent company or organization is Healthy Birthday Incorporated. They were so excited about the proclamation that they had one of their representatives come and actually take part in our proclamation signing. And so she came all the way from Iowa, and we were also fortunate that we had a local mom and baby save, as they're referred to, here in Montgomery, that also took place in the proclamation signing. And so we had Shamari and Aspen Cook. They came and they were part of the proclamation signing. And so it's there, and again, it's another way trying to connect things in the body back to the mouth.
Well, and it seems as though you all, in just a few short years that you've been here, have done a lot to further that connection and make people more aware, and then to have it celebrated with a proclamation signing, and for Alabama to be on the forefront, which is always good to hear. Mallory, let's bring you into this conversation, because I heard Dr. Harris say that water fluoridation is one of the biggest accomplishments of the dental profession. Now, I have to be honest, I had never heard the word fluoridation until I started researching this story last month. So why is that such a huge achievement, and what is fluoridation?
Well, fluoride comes from fluorine, which is one of the 15 most commonly found elements in the earth. And fluoridation is just adjusting it to the optimal level that helps prevent tooth decay.
So when we are brushing our teeth, are we getting enough fluoride in that water to prevent tooth decay, or is the fluoridation just a way to kind of bump it up and further ensure that our teeth are being well protected while brushing?
The fluoridation definitely helps bump it up, and of course it depends on if your local water authority does fluoridate in their water, and then of course if you're using fluoride in your toothpaste.
But I know you all have a grant program that helps communities that want to take part in that. Talk a little bit about that grant program to encourage communities to better fluoridate their water.
Okay, yes, we do. We offer funds to help communities that either already fluoridate, adjust their system to continue fluoridating, or maybe a water plant that doesn't fluoridate, help them to initiate fluoridation. And we send it out every year, and it is competitive, and we grade them, and then we award funds to different water plants in Alabama.
So I should be using fluoride toothpaste. Does all toothpaste have fluoride in it, pretty much?
Pretty much, but there is some that does not.
Okay,
so
okay.
Make sure.
What about drinking water that's fluoridated? Is that helpful as well, or would that be too much?
It's not too much. Some bottled water companies do add fluoride, but that's very uncommon. So when teeth and bones are still growing, when you drink fluoridated water, it helps protect your teeth, and it helps neutralize the bacteria in your mouth, and that helps protect your teeth as well.
Oh, excellent. So anything else you want to share about fluoridation that we need to know? Because I was fascinated. Like I said, I was on your website and I was going through and I saw you have like a couple of pages of pamphlets and information about fluoridation that if anybody wants to go to the website and see. But what are some other things about fluoridation that we need to know?
Well, a big one that stuck out to me because I'm rather new in this position is for every dollar spent on fluoridation, it saves $20 in dental care.
Wow, that is fascinating. So these investments are making great long-term health investments for all of us. Okay, excellent. Well, Dr. Johnson, as we begin to wrap up, I just wanted to just briefly mention you all do have community dental care. Interviewed Jennifer on that story last month, and the big piece of that is connecting people with dental insurance and also going into schools and checking for tooth decay. Take about 30 seconds to share that work because I think it's important that we mention that while we have you all here today.
We just finished up what's called a basic screening survey. It's like a 5-year needs assessment, and what that is we go into, we had 52 different schools that we went to throughout the state, and we checked kindergarten and 3rd grade children to see the incidence of decay, whether they had treated decay, untreated decay, or the presence of sealants. And so by doing things like that, that falls under our surveillance category when we look at our goals in the state oral health plan. By looking at those numbers, we've been able to identify one particular area in Alabama that has a tremendous surge of tooth decay in their children. And so that's part of what Jennifer does. She actually helped us plan this entire event. Going into schools and educating the students and the teachers because they need to know why it is that they do what they're doing, not just be told that they need to do it.
Exactly. And what I found interesting when I spoke with her was that she mentioned that we aren't seeing dentists applying sealant in children as we normally would. I think it's worthy to note because that's incredibly important when you talk about tooth decay and long-term tooth health. Sealants last well until adulthood. It's typically covered by insurance for children. If an adult wants to get a sealant, it's not a very expensive cost. So we want to encourage everybody to do that. Now, as you know, we at public television, we are educational TV. I would be remiss if we didn't leave out of here without some great education tips. So brush twice a day. Floss once at least. Floss once a day.
At least.
I should go get my teeth cleaned how often?
The recommendation is every 6 months.
Every 6 months. Soft bristle or hard bristle toothbrush? Soft. I knew you were going to come in hard on that one. And how much toothpaste on that toothbrush? Because I heard just a teeny tiny amount is all you need. Is it?
For an adult, it's about pea-sized.
Pea-sized.
And for a child, it's more like a grain of rice.
Okay. Well, I want to let all of our viewers know there's a treasure trove of information on your website. I was just fascinated as I was going through it, and we're going to put that website up on the screen. We also want to let our parents know that you all have activity sheets and coloring books and puzzles for, I think this one is for K through 5, and this one is for 5th grade and older. So as they talk with their children about dental care, they can also make it fun. And I just printed all this information from your website. It's colorful, it's attractive, it's easy to use. And I just thank you all so much for what you're doing. Anything else you all want to share about the work that you're doing that I didn't think to ask before we close this interview today?
Just the fact that you have mentioned all the different information that's available on the website. And by all means, just please go and take a look at it. And there are ways in there to contact us to be able to get these different things. One of the things that we face is when different areas of the state, if they decide that they're not going to fluoridate anymore, and a lot of times they won't tell the community about it until it's actually already done. So we were able, in 2018, we were able to pass a fluoridation law. And what the law states is that if a community water fluoridation operation is planning to discontinue fluoridation, then they have to notify the state health officer at least 90 days in advance. And that way we will know about it, so we can go out and educate the community and kind of rally the troops, so to speak. But one of the reason I bring that up at all, and looking at our website, Mallory has this is a fluoridation toolkit that we developed, which is extremely useful for communities for that purpose. We also have smaller brochures that are a condensed version of that that we have at health fairs and places like that. But basically everything that's available on our website we will be glad to provide it to people at no charge. And there's a downloadable version, a PDF version of the state oral health plan that's on there as well.
It sure is. I looked at it myself. That's where I printed that cover sheet from. Well, thank you for what you're doing. We talk about closing the gap. That final statement you mentioned speaks back to your mission of closing this dental health care gap for dentists, for the community at large, for all of us. And so we thank you for what you do. And don't be a stranger. Always come back here and join us on Capitol Journal.
Thank you so much. We appreciate it.
You're welcome. And we'll be right back.